Okay, let's go now to Chris Kastelan. He joins me. He's the president of the New South Wales branch of the Paramedics Association. Chris, thank you very much for your time. With the Westmead situation, a lot of pressure in terms of COVID cases. What are you hearing from your members?
Our members are telling us that certainly the Westmead and also Blacktown, Liverpool and the Nepean hospitals run under significant strain. We're finding that we're having up to 10 paramedic crews with COVID-positive patients stuck in the emergency departments for up to around 6 hours at a time. Paramedics are doing 17, 18-hour shifts in very confined spaces. We're concerned about the safety for these paramedics. We're also hearing that some of these Western Sydney hospitals are closing updating their matrices so that they're not accepting respiratory patients. So paramedics are driving around Western Sydney trying to find an emergency department that will accept a patient, a respiratory patient that needs acute care. And that ended up with Concord Hospital last evening with cars stuck for up to 5 hours in pouring rain, unable to access any facilities, any acute medical care. And this is plainly not good enough after 18 months worth of pandemic supposed preparedness, that we're coming to a point in time where hospitals are closing their doors to COVID-positive patients, and there is real concern on the ground by paramedics as to how this is going to pan out over the next period of time.
Yeah, so we've had that reporting that Westmead has closed its doors to COVID patients after receiving some 40 COVID patients a day in the last week. This is obviously enormously stressful for your members dealing with so many COVID patients, as you say, in confined situations. What are they doing to try and protect themselves in the face of what is a very difficult ongoing situation with more than 900 COVID cases today?
Look, paramedics are certainly a very stoic bunch and a professional bunch. We are following all the personal protective equipment requirements that New South Wales Ambulance has asking us to do. But unfortunately, some of the paramedics are in PPE for up to, and as I said earlier, over 6 hours period of time. There's been instances where mobile x-rays have been rolled out into the emergency department and x-rays are being done in the back of the ambulance. This is concerning for us in regards to patient safety and also patient confidentiality. The paramedics are telling us that the facilities are just not there for acute clinical care for patients presenting unwell and for the paramedics that are stuck there for, as I mentioned, up to 17, 18 hours for their shift. And these paramedics are turning around and coming back and doing it the very next day. And we really want to see better facilities there, not only for the patients to receive acute care, more beds opened up, more resourcing available to these patients, but we want to make sure that paramedics are able to care for the community in a safe manner. There's been no testing as to what the implications are of paramedics being in a confined space for this extended period of time with positive COVID patients, because ultimately no paramedic wants to be responsible for bringing a COVID concern to an area that's currently not suffering from any COVID cases, and that's a real concern for paramedics.